Welcome to First Sleep Aid, calm stories to help you unwind, learn, and fall asleep. From true crime to curious facts and thoughtful ideas, always softly spoken. Subscribe now and take a deep breath. You're in good hands. Welcome, everyone. In this deep dive, we're going to explore something truly fascinating, the way our minds and bodies seem to, well, talk to each other in ways we don't always expect.
Right. Specifically, we're looking at how belief, just sheer belief, can sometimes lead to real, measurable physical changes.
Exactly. Our mission today is to really get under the hood of the placebo effect. We're moving way beyond just a simple definition.
We want to trace its history, look at the biology behind it, touch on the ethics, which are quite tricky.
Yeah, definitely. And see how it shows up even now in our modern lives. We'll be drawing on history, science. It should be a really immersive journey.
It's quite something to think about, isn't it? This link between our inner world thoughts, expectations, and our physical bodies.
We tend to see them as separate.
Completely. But the placebo story really shows how, interconnected they truly are.
Okay, so let's jump right in with a really powerful image. Think about Italy, World War II, 1944. A field hospital. Just chaos. And a medic is faced with a soldier, terrible leg wound, begging for morphine. But the supplies, they're gone. Completely out.
A nightmare scenario.
So a nurse quickly whips up a syringe of saline solution, just salt water, basically.
Nothing active in it at all.
But the medic, with total conviction, looks the soldier in the eye, says this will help, and gives the shot.
And the amazing thing is what happens next.
Yeah.
The soldier's agony. It doesn't vanish, not entirely, but it lessens. Enough for him to calm down, his breathing steadies.
Wow.
He finds the strength to face the amputation, and crucially, he survives. It's unlikely anyone truly understood why it worked back then.
Just desperation and maybe intuition.
Probably. But it's such a stark early glimpse of this power, something beyond just the physical intervention.
It's like the body listened to the promise of relief. And this wasn't just a one-off, right? We go back even further, before modern science.
Oh, absolutely. Healing was so often wrapped up in ritual, in symbols, in belief in, well, unseen forces.
You think about ancient Egypt. Priests were often the physicians. Their treatments were a mix of herbs and maybe incantations.
Precisely. Or the Greek temples of Asclepius. People would sleep there, believing their dreams held the key to their cure.
So the belief itself was part of the medicine.
Exactly. In those times, what we now call the placebo effect was just part of the sacred. Rituals weren't just symbolic gestures. They were seen as vital for healing.
A framework for understanding suffering, maybe making it more manageable.
A way to find meaning, a chant, a specific action. It connected the illness to something bigger.
And the word itself, placebo, has its own weird history.
It does, yeah. It starts in medieval Europe, from the Liturgy for the Dead, placebo domino, I shall please the Lord.
Okay, religious roots.
But then by the 14th century or so, it shifted. It started being used for people who faked grief to get something, like performing sorrow.
So from pleasing God to pleasing people, potentially deceptively.
Kind of, yeah. That idea of performing an action to get a desired response seems to stick. By the 18th century, it enters medical language.
But not as a cure.
No, more as something inert to placate a patient, to soothe anxiety when maybe the doctor didn't have much else to offer. Sugar pills, water tinctures.
Were they trying to deceive them?
Not necessarily maliciously. Often it was maybe compassion, offering something. But here's the kicker.
That's that.
Even these early inert treatments sometimes seem to work. Patients felt calmer, fevers broke, things healed faster than expected.
That must have been confusing for doctors working with just a physical model.
Very. They were accidentally bumping into this principle.
Yeah.
The expectation of healing can actually start the healing process. The mind anticipates and the body follows.
But it took a major conflict to really bring this into the scientific spotlight.
It did. And that brings us back to Henry Beecher, his WWII experiences, especially that saline incident you mentioned.
It stuck with him.
Deeply. He went back to Harvard after the war, obsessed with this question. Can belief alone actually heal?
So he decided to test it properly.
Rigorously. He set up controlled trials back at Harvard, using sugar pills, saline injections, taking away the chaos of war to isolate that one factor, belief.
And the results, you said they were staggering.
Absolutely staggering. Across many studies, a really significant number of patients showed genuine improvement with these inert treatments.
But only when they thought it was real medicine?
That was the crucial part, yes. when they believed they were getting something active. This wasn't just a few anecdotes, it was a consistent pattern.
You mentioned a figure earlier, 35%.
That was his estimate in his huge 1955 paper, The Powerful Placebo. Up to 35% of a treatment's effect could be down to this placebo response.
Wow, 35%. That implies belief is almost as strong as some drugs.
It certainly suggests it plays a massive role. That paper sent shockwaves. There was skepticism, of course. People thought it was bias, noise.
But the data held up.
The weight of evidence was too strong. Beecher's genius wasn't just noticing the effect, but quantifying it, forcing medicine to take it seriously.
So he didn't exactly discover it, given the long history we talked about.
No, not discover it from scratch.
But he defined it scientifically, measured it, and made it impossible to ignore anymore.
Exactly. He brought it into the lab. But in doing so, he also highlighted this paradox at the heart of medicine.
Which is?
If a treatment works, partly because you believe in it, is it less valid? And his work directly changed how we test drugs.
Ah, the double-blind, randomized controlled trial.
Precisely. It became the gold standard.
Yeah.
You have to compare a new drug against a placebo to know if the drug itself is doing anything beyond belief.
But that means you have to give some people a fake treatment. You have to, well, not tell them the whole truth, at least initially.
There's the ethical tangle. Beecher's science, while groundbreaking, uncovered this tightrope.
How do you balance rigorous testing, which might need that blinding, with honesty and patient trust?
It's a huge question, a fundamental tension that medicine still grapples with today. How do we measure effectively and remain completely transparent and ethical?
Okay, let's shift gears a bit. Let's move from the history and the methods to the biology. For a long time, people dismissed this as all in your head.
Right, purely psychological. Maybe even imagined.
But neuroscience, especially with new imaging tools, has shown something different, hasn't it?
Completely different. It's shown there are real, tangible changes in the brain and body. It's not just a feeling. It's biology.
So how does that work? What's happening in there?
Well, neuroimaging lets us actually see the brain responding to belief. It's not vague. It's neurobiology. A key player seems to be the prefrontal cortex.
The brain's CEO.
Kind of, yeah. It handles higher thinking, expectation. When you expect a treatment to work, this area lights up, and it sends signals downstream.
The other parts of the brain and the body.
Exactly. These aren't just thoughts. They're electrochemical messages that influence physiology.
And the early evidence for this came from pain studies.
That's some of the most compelling research. People given placebos for pain, believing it's real medication, show brain activity changes consistent with actual pain reduction.
You can see it on the scans.
You can. Increased activity in areas like the periaqueductal gray. Think of it like the brain's pain control center and the anterior cingulate cortex, involved in the emotional aspect of pain.
And less activity where pain is usually registered?
Right, less activity in the somatosensory cortex. So the brain seems to be actively turning down the pain volume because it expects relief.
It's like the brain is producing its own painkillers.
And that's exactly what other studies found. The body releases its own natural opioids, endorphins, during these placebo responses.
Endorphins, right.
And here's the clincher. You can block these placebo pain relief effects with naloxone.
Naloxone. That's the drug they use to reverse opioid overdoses, like morphine.
Precisely. The fact that naloxone blocks the placebo effect strongly suggests that placebos and drugs like morphine are tapping into some of the same pain relief pathways.
Wow. So it's not just subjective feeling, it's hitting the same chemical systems.
It really bridges that gap. And it's not just pain. We see similar things in other conditions, too.
Like
In Parkinson's disease, placebos can increase dopamine levels in the affected brain area, leading to temporary motor improvements.
That's incredible.
In depression, you see activation of serotonin circuits. In irritable bowel syndrome, changes in immune responses. Even in asthma, objective improvements in airflow after a placebo.
So the brain seems to tailor the response depending on the condition.
It looks that way, yes.
Yeah.
It's quite sophisticated. It suggests the brain can target its own healing mechanisms quite specifically. The anticipation of feeling better might trigger the release of natural painkillers, leading to less pain.
It really shows how powerful expectation is across the board. But you said earlier, this doesn't just happen spontaneously. It needs a trigger, right? Cues.
Absolutely. The brain is always scanning for signals of safety, healing, or danger. In medicine, these cues are everywhere.
Like the doctor's white coat.
That, the authoritative voice, the ritual of an exam, the smell of the clinic.
Yeah.
It all feeds into our expectation.
And trust seems really important here, too.
Fundamentally important. If you trust your doctor, you're much more likely to have a strong placebo response. Trust acts like a potent neurobiological trigger. It gets the ball rolling.
Which leads us naturally to think about language. It's not just the setting, but what's said, isn't it?
Oh, hugely. And the neurochemicals we mentioned, dopamine, endorphins, serotonin, oxytocin, feel like the messengers carrying the meaning of those words and expectations.
Dopamine for reward anticipation.
Endorphins for pain relief and calm, serotonin for mood.
And oxytocin, the bonding hormone.
That helps build the trust and connection in the therapeutic relationship. These chemicals are the body's way of translating meaning into physiology.
So the way a doctor talks, their tone, confidence, empathy, that actually matters biologically?
It has a measurable impact. Think about the framing, saying, "This will definitely help," versus, "Well, let's see if this works."
Huge difference in the expectation you create.
Exactly. The first one primes the brain for a positive outcome. A confident, caring voice becomes a therapeutic tool itself. Studies show a strong doctor-patient relationship boosts placebo effects.
But there's a flip side to this, a darker side, the nocebo effect.
Right, the nocebo effect is where negative expectations actually make things worse.
How does that work?
If you're told to expect nasty side effects, even from a sugar pill, you're much more likely to experience them. Negative words, a pessimistic prognosis delivered bluntly.
That can actually harm.
It can trigger negative expectations, worsening symptoms, reducing well-being. It really highlights the ethical weight of language in healthcare. Every word matters.
Which brings us squarely to the ethics. Using traditional placebos often involves, well, not being entirely upfront. Concealment, maybe even deception.
And that clashes fundamentally with principles like honesty and informed consent. It's the core dilemma.
How do you justify potentially misleading someone, even if the goal is scientific rigor or even therapeutic benefit?
It's tough. But research has evolved, leading to fascinating work on what are called open-label placebos.
Open label, meaning people know they're getting a placebo.
Exactly. They're told explicitly, this is an inert substance. It has no active medicine. But studies show placebos can trigger self-healing responses.
And does it still work? That seems counterintuitive.
Surprisingly, yes. A growing number of studies show benefits, even when people know it's a placebo, for various conditions.
How can that be if you know it's fake?
It suggests the benefit isn't just about deception. Maybe it's the ritual of treatment itself, the structured attention, the permission to expect improvement that comes with engaging in any treatment process.
So it shifts the idea from placebo as a lie.
To placebo as potentially an honest ritual, a way to engage the mind's healing capacity transparently.
That really changes the conversation about how doctors should communicate diagnoses and treatments too.
Definitely. There's this idea of contextualized disclosure, finding that balance, being honest, giving patients all the facts, but also being mindful of how you frame it, because words have power.
Acknowledging the patient's right to know, but also the impact of expectation.
And remembering the nocebo effect, the responsibility to use language carefully, constructively.
It's interesting how these ideas are spilling out beyond the clinic now into the whole wellness world. Fitness trackers, biohacking.
You call it the rise of the quantified placebo?
Quantified placebo.
Yeah. These devices and practices often work, at least partly, by tapping into our belief in self-improvement and the power of data. Monitoring yourself, following a strict plan.
It gives you a sense of control, agency.
Exactly.
Yeah.
In a world that feels uncertain, our bodies become something we can manage, track, optimize. The act of tracking, believing it will help, can create a self-fulfilling prophecy.
But you said it's a double-edged sword.
It can be. That illusion of control can lead to disappointment or anxiety if the promised results don't materialize.
And are people now thinking about designing healthcare spaces or tech specifically to leverage this?
Yes, that's the emerging field of placebo design. Using things like neuroarchitecture, designing buildings to positively affect our mood and nervous system.
VR AI.
Potentially, yes. Using technology, environment design to intentionally foster positive expectations and create more therapeutic settings. Ethically, of course.
So ultimately, the placebo effect isn't just this weird anomaly. It's always there.
It's a silent partner in every single treatment, even with active drugs.
How so?
Your belief in the drug, your trust in the doctor who prescribed it, the branding, even the perceived cost, all these contextual factors can tweak how well that active drug actually works for you.
There was that study about morphine, right? Visible versus hidden.
Right. Giving morphine openly, where the patient sees it and expects relief, is often more effective than giving the exact same dose hidden in an IV drip. Conscious expectation matters.
And the open-label placebo results reinforce that healing can happen through active engagement, through hope, even without pharmacological action.
It challenges that purely biological view of healing. It suggests our participation, our expectations, the context of care. These are powerful forces too.
Which leads to that idea of the doctor as a ritual architect.
Yes, someone who consciously shapes the encounter, words, gestures, environment to create trust and meaning, maximizing the patient's own healing potential.
So let's bring it back to that story, the person in the trial who got better on the placebo.
Such a powerful illustration, like the soldier in Italy. It just underscores this incredible, often untapped power of belief and the body's responsiveness.
It makes you wonder, doesn't it? Maybe healing isn't just about fighting disease from the outside.
Maybe it's also about reimagining our relationship with our own minds and bodies.
Yeah.
Perhaps the brain sometimes needs permission to heal more than it needs proof from a pill.
It comes back to presence, context, connection,
Yeah,
all those things we discussed.
absolutely. And it suggests that even the pill that wasn't, the inert placebo, might hold the deepest lessons about what healing truly is. That mind-body connection is just fundamental.